So Maggie Buck, Mary Buck, and Laura Calhoun. So if y'all could just state your name for the record.
Laura Calhoun.
I'm Mary Buck.
Maggie Buck.
Okay, thank you. And you can go, whoever wants to go first.
Okay, I'll start. First, we weren't sure what agenda item we would really fall under, so please forgive us if we're in the wrong one. Sitting here listening to the speakers before me and listening to you, Madam Chair, the obvious concern that you have for the mental well-being of the people of our state is an overwhelming surprise. Because from the average citizen's perspective, my perspective, one who knows nothing of the legislative process, it has been clear to me for years that the mental health of Louisianians is of little to no importance to the policymakers and administrators of this state. Which is astonishing to me because we know that every elected official, including all of you that sit on this committee, and every elected official has seen and dealt with the breakdown of a loved one's mental health. I can say that with certainty, even though I don't know any of you, because I know and you know that serious mental health disorders are so pervasive in our state that they leave no one untouched. The list of my loved ones suffering is long and goes from depression to alcoholism to schizophrenia and everything in between. But I am here today to talk about the secondary victims of mental health disorders who go without the mental health care that they need. Specifically, my friend, who is here with me today. She is a mom to 3 incredible kids. Her ex-husband, the father of her oldest 2, is a veteran and an addict. Everyone recognizes the price he has paid for our freedom. But what about the price she and her children have paid? She carries the mental anguish of a failed marriage to a man she was unable to help. She carries the mental and emotional burden of trying to mitigate that trauma inflicted on her children. And despite her best efforts, her kids are still traumatized. Where are the services for her and her children? Where are the mental health professionals who take Medicaid who actually have appointments available? What about her youngest, the 3-year-old girl who started coming home months ago from weekend visits with her father, telling her mother and her brother and her sister horror stories of the abuse done to her? My friend will speak to her daughter's mental health. But I ask, where is the emotional help for her as a mother, who is forced by the state to send her baby back to her abuser? What state department, what phone number, what name is she supposed to reach out to when she collapses into the abyss of despair because she is unable to protect her child? Where is the support for her other 2 children who watch helplessly at what is happening to their little sister and the toll it is taking on their mother? And let me tell you about their mother. She is a walking miracle. She is a woman who has suffered unimaginable trauma herself from the earliest memories and has lived through abusive relationships her entire life. And yet she is still a beautiful light in this world. She is doing everything right for her children. She is fighting for them in every way possible. But the state of Louisiana is not. Here you have a woman who is desperately trying to stop the generational breakdown of mental health in her family, and the state is nowhere in sight. She is the poster child who our state's resources are supposed to help. And in other important areas, the state is doing its job. My friend and her children live in government-subsidized housing. They receive SNAP benefits. But where is the mental health treatment that could allow these children to grow up and flourish so that in the future they won't become dependent on subsidized housing and food assistance? My friend has called and emailed and begged face-to-face in desperation for the state to help. And this state has ignored her and turned its back on her children. My questions to you: are the members of this committee able to help them? Are you willing to help them? And when? Now, or when these 3 babies grow up and are sitting in another committee meeting as adults still begging for a change to a broken system. Thank you.
So, Ms. Calhoun, let me address some of what you said. I could see the pain, and I'm so sorry for everything that you've experienced. But I know, so when I did this House resolution to create this committee, everyone here, we can't speak for every policymaker, right? But everyone here just wanted to volunteer and wanted to be on this committee. I mean, I know I became a counselor because I do care about people. I know you also have Rep. Selders as a social worker here. I think Rep. Hughes was one of the first people to say, please let me be on that committee, and, along with all my other colleagues. So we're hoping that this can create, we can learn, and we know that people are in a mental health crisis, and hopefully we can come and address this issue. So I want to let you know, I'm glad you came to the table so we can hear, just from individuals and how this is really impacting them. So we are listening, and hopefully with our committee, we can, come up with some solutions to help the people of Louisiana. So
Thank you so much, all of you. Thank you.
and we actually do have a question or comment from Rep. Eccles.
Just going to say, what area do you live?
I live in Greenville Springs.
But DCFS is participating in St. Tammany.
But DCFS is involved in St. Tammany Parish.
The answer I was looking for. Okay. Thank you.
Mary Buck again. I'm here today to call in a question why the Department of Children and Family Services are solely responsible for our state's children's mental health. DCFS workers are not licensed mental health care professionals. They do not work with the sexually abused and abused kids every day, every week, or even every month. My child sees the highest recommended licensed therapist on Hope House's referral list. This therapist used to be a Hope House worker herself before getting her doctorate and opening her own practice. Her practice is known far and wide for being in the business of identifying the problem and then healing it. Even though this doctor's experience and expertise far outweighs any worker within the Department of Children and Family Services, DCFS has blatantly ignored any attempt made by my daughter's therapist to help my child. For the entirety of 2023, DCFS has ignored not only myself, my 3-year-old daughter, and my other children's plea for help regarding the sexual abuse of my 3-year-old, but they have decided to ignore the guidance of her therapist, who has seen her every single week since March. My child's therapist have told DCFS weekly now that my daughter is a victim of sexual abuse at the hands of her father and stepmother. Her therapist have watched my child hide herself and her dolls in therapy from her father's sperm. They have watched her be so angry that she's destroyed the entire room after having contact with her father. DCFS knows of these stories, yet DCFS continues to ignore my child and her therapist. Due to our laws and policy funding, DCFS seems to only be in the business of making money off of our state's children and not actually helping them. If DCFS is overworked and understaffed, why are they not utilizing the education and expertise of our healthcare and mental health professionals? Why does DCFS and our judicial system suggest and sometimes even require we see and pay licensed healthcare professionals if no one is listening to them? At the very least, DCFS should rely on the professionals who sit with children weekly and see the trauma in all of its many forms. The healthcare professionals who see the family as a whole and recognize the dire need for healing and safety are the voices who should be heard when advocating for our state's children. We cannot heal a child who is consistently exposed to her abuser. We cannot reintroduce the trauma over and over again and expect our children to heal. Yet this is what DCFS is allowing by turning a blind eye to my daughter and failing miserably to listen to her healthcare professionals. I am asking you all to please help my daughter. Please listen to her healthcare professionals. Help us all to protect her. Sexual abuse is more than just what the abuser does in moments of abuse. It falls on the victim to heal themselves afterwards and to resolve the many other symptoms of sexual abuse. Once again, I am asking you all to help me help my daughter by passing a bill that shifts power from DCFS and allows the actual mental health professionals to advocate for abused children, especially since DCFS has failed our children for years. DCFS works hand in hand with lower class women, children, and families. These people are almost always stuck depending on DCFS for many different services, all while never getting better. Our mental health starts as early as in the womb. Why are we relying on a state entity like DCFS to be in charge of mentally ill children and families? Why aren't we placing the responsibility where it belongs? With licensed healthcare professionals. Please consider writing a law to relinquish DCFS making what should be healthcare professional decisions. This is where the state can start to heal.
Thank you, Mrs. Buck. I'm so sorry for what you've been through, and I know Rep. Eccles has a comment or question.
My question is, have you ever been able to utilize the services at one of the centers for children and families in Louisiana?
No.
So there are 4 centers around Louisiana. I only know this because I was on the board of directors for it in Monroe, but they provide many of the services that you're looking for in a private basis, but they do accept Medicaid in instances. So there's one in Crowley is probably the closest one here from Baton Rouge. There's one in Monroe. There's one in Shreveport, and there's one. Let's see. Well, Clinton, Mississippi. So I don't know if that's closer than here, but I would highly suggest you look up and see if that's an opportunity for you to get different service lines: abuse, neglect, families, rebuilding families, lots of other connected services, therapy, child welfare, crisis intervention, all happens at those centers. So I know the number for Monroe, it's 318-398-0945. The one in Crowley, you can find it online, 337-415-5181. Now, DCFS, I certainly understand the issues there, and I was talking to my colleague just a moment ago about this, and there's absolutely a challenge, and we've got to overcome those challenges. We can't continue to have these types of outcomes, and so I'm so sorry for your situation, and if there's anything we can do for you as a committee, obviously we want to make sure you have access to services, but this is one place I think you could start and definitely change some of the outcomes you have right now.
Thank you.
Yeah, that's good. All the microphones go off when here we go.
Maggie Buck. Louisiana is ranked 49th out of 50 states for the well-being of children. And after my personal dealings with our governing officials, as well as the Department of Children and Family Services, I am left wondering how any state could possibly rank worse than Louisiana. Since the early days of 2023, my sister and I have been fighting to keep my niece, which is her 3-year-old daughter, safe from the hands of her sexual abusers, the child's father and stepmother. However, no matter how much evidence turns up, no matter how many horrific stories this child shares with medical professionals, DCFS, family members, or strangers, we are unable to keep her from her abusers. Why? Because of the total corruption in our politics, Department of Children and Family Services, as well as our judicial system. This is a 3-year-old who tells stories of her father and stepmother sodomizing her, as well as tickling her privates. Still, to this day, they currently have the right to visit with the child away from the child's mother every other weekend for 16 hours. We are here today to discuss the mental health and welfare of our state, and I am here as an example of why the health and welfare of our state is more than on a decline. It is on the brink of collapsing. Can you imagine going to bed listening to the sexual abuse stories of a 3-year-old? What about the sexual abuse stories being told from the mouth of a 3-year-old that you love? I can imagine it because I have had to live with it for over 9 months. Every time the lights are out and the bed is near, my niece shares the horrific stories that have been done to her at the hands of her abusers, likely because the bed is a trigger for her. What would you do in my shoes? Try to silence the child like DCFS and our governing officials have tried to? I cannot. So I listen and I thank her for sharing. Thank her for being brave, even though I know these stories must terrify her. Our mental health crisis is not due to a lack of funding. The failures of our children's welfare is not due to the lack of funding. It is due to the lack of accountability that our officials have. It is due to the lack of oversight over the Department in Children and Family Services. It is due to Louisiana spending more money to cover up its failings than what the state spends on actually fixing its failings. I've reached out to everyone from the governor's office to the head of DCFS to many, many state representatives over the course of 9 months, and no one has done anything to keep a 3-year-old residing in your state safe from sexual abuse. So, Louisiana, as we gather today to discuss our state's mental health crisis, let us not be distracted by the small talk of policy and jargon. Our children's mental health crisis and our state citizens' poor quality of life is directly linked to the lack of accountability that our government has, especially the Department of Children and Family Services. Addiction, crime, personality disorders, and many other mental health illnesses all have been linked to childhood trauma. Why are we as a state so focused on putting a Band-Aid on the problem for our adults, but not fixing the root of the problem, which is our children? The childhood trauma is what causes the mental health crisis that we see in adults.
Thank you so much, Mrs. Buck. Rep. Hughes has a comment question.
Thank you, Madam Chair. Let me just sincerely thank the three of you for your testimony today. I think we all not only hear but see your pain, and I just want to let you know we hear you. I agree with you 100% with regard to DCFS. It is a broken agency. It's dysfunctional, and I'm hopeful that as we move forward, we can, really make some transformational change. What you're saying today, we've quite frankly heard time and time and time again, and many of us sitting on this dais have sounded the alarm and will continue to sound the alarm. But I'm not going to sugarcoat it. I agree with you. DCFS is broken. And on behalf of our children and families, we have an obligation to fix it. So I sincerely apologize, but thank you so much for the courage to come here and speak today. And I just want you to know that we hear you. Thank you.
Thank you.
Thank you so much for coming.
Okay, so I think right now what we'll do is we do have some public testimony that they would like to take place. I guess I'd like to set the ground rules a little bit on this. If it's something that's really very, very specific for your family, I have talked to, because I'm not sure what the testimony will be. I have talked to the secretary. She said her staff is available to meet, and get to really talk about that subject matter. If it's concerning a case that's been adjudicated, it's been adjudicated, so we'll kind of make sure that we're doing the right thing on this. So I'll start just naming some folks that would like to testify that are present. Magdalene Buck, Lova Calhoun, Tara Tullian, and we can take three at a time. So if you're here, now would be the right opportunity to address the committee.
I do understand that.
Well, you'd have to come and introduce yourself and go from there. And I tell you what we'll do, because we'll go with a 5-minute timeline. That
For each
way,
person?
I think everybody can get what they need done in 5 minutes. And whoever would like to begin first, it's yours. Just state your name, and we're happy to accept your testimony.
Okay.
Okay.
Can you go first?
You're going to go first, what they said?
Yeah.
We have packets for you guys to review, the people that are on the board. Do we go ahead and pass them out?
It's all three. 1, 2, 3.
Let us take a look at it. Let us take a determination as you're talking. Yes. Yeah, let's see him. You're so good. Thank you. 3? Okay, let's see what we got.
I got that. I got it.
We just want to make sure with confidential information, there's certain things we just want to make sure. So once you take your testimony in, and then we'll start reviewing these documents to see if we're going to distribute it.
Start. Okay. Before Laura Calhoun, before I start, I did hear the parameters that you set forth before we came forward, and at first it may appear that we're kind of discussing an individual case, but it is. We are speaking to the broader system of DCFS and their failure to follow their own policies.
Thank you for being
thank
here.
you. Again, my name's Laura Calhoun. I'm happily married, mom of 4, and a devout Catholic. I thank God that I have never had to deal with DCFS concerning my own family. However, I'm intimately aware of how the total dysfunction of DCF's system has not only failed to keep my dear friend's daughter safe, it has allowed the ignorant and corrupt of whom it employs to actively seek to put this child back into the hands of her abusers. Let me be crystal clear. There are individuals on the DCFS payroll who not only know, but have acknowledged that this child is being sexually abused by her father and stepmother, and those same individuals are fighting to send this precious little girl back to be physically abused, sexually abused, sodomized, and threatened to keep her silent. This story is so profoundly illicit that for those who have not lived it for the past 9 months find it impossible to believe. And their disbelief is understandable. Because why? Why would DCFS not protect this child with the mountains of evidence that has been collected? Why would the individuals of DCFS fight so vehemently against this mother who is trying to save her child? I'll give you 2 reasons. The first is Quintina Washington, the original Baton Rouge caseworker. She believed that overwhelming physical evidence of trauma to this child's vagina and anus had to be present, and because it was not, Quintina stated that sexual abuse was not being done to her. So she refused to investigate further. Quintina, who has absolutely no medical training in identifying sexual abuse. Second is Ashley Jones, the current St. Tammany caseworker, whose first action upon taking up this case on June 2nd was to interview the father and stepmother. Then she did nothing. Absolutely nothing.
Yeah, point of order here. Let me put you on, Jay.
Okay, thank you.
No, we can't.
Mr. Chairman, I'm concerned about the legalities of what we're doing here because I understand these ladies are very passionate about that and they want to get their message across and we need to hear it. I do not think it's appropriate for us to go into naming individuals. If you want to say it's a worker or what their classification is or something like that, I think it's problematic for us, especially we cannot name a child. And I think it's problematic if we name employees of the department as well in this particular hearing. This is not the
Are we
place
allowed
to
to
do
name
that.
Terry Ricks and Amanda Brunson?
No,
ma'am.
This
I-
is
I
not
would-
a trial. This is to take in information to get the department to improve. If you want to visit with the staff or the secretary, she has her attorneys with her. She would be more than happy to. But to name a patient or a child that
Not naming
finds-
the patient as
No,
children.
I'm just setting some ground
Employee
rules.
too, ma'am.
Or an
I think
employee
that's
also.
problematic.
It's problematic. It could be some legal issues for a lot of issues. So we want to set some ground
I can
rules
do
to
that.
protect you, to protect the integrity of the committee, and thank you very much
Thank
for
you, Mr.
bringing that
Chairman.
out to us.
I can do that. Okay, so she did nothing. She did not interview my friend. She did not interview the sexually abused child. She did not interview my friend's other 2 children. She did not interview the 3 other girls who live in the home with these pedophiles. If she had, she would have known that 2 of those 3 girls have disclosed their own abuse. How poorly trained does a caseworker have to be to sit down and interview 2 pedophiles and be convinced by those monsters that all they're dealing with is a crazy ex-girlfriend? Where is the oversight? Who is responsible for training these caseworkers? Who are the supervisors asleep at the wheel? The changes Governor Edwards instituted after children were dying under the watch of DCFS have done nothing to negate the dereliction of duty of those at the bottom. And it goes further than failing to follow policy and not interviewing all relevant parties. The St. Tammany Parish caseworker went so far as to drive from St. Tammany Parish to Baton Rouge on July 26th to testify in court that she was closing this case. She was not subpoenaed. She had no reason to be there. But there she was. Unprovoked, she approached my friend in the halls of the courthouse in front of me, my friend's attorney, and several other witnesses and announced that she was closing the case in St. Tammany and she was there to tell the judge as much. Ladies and gentlemen, this is DCFS. These are our tax dollars at work. What is it, over $850 million? I have had to start a GoFundMe to raise the money needed to fight for this child in court. My friend has no financial resources to do this on her own. We have had to rely on the generosity of strangers to pay attorneys and hope that they will be able to keep this little girl safe. Tens of thousands of dollars that none of us have. To do what we pay DCFS $850 million to do. This case is one of the easiest DCFS is involved in. It couldn't be more clear-cut. If they can't get this one right, Louisiana is not only wasting taxpayer money, but promoting moral evil and corruption by funding an agency whose actions are in direct opposition of its mission. And before I end my testimony, I want to be sure you know the truth about this crazy ex-girlfriend. She was a practical stranger to me, but during the flood of 2016, she and her kids moved in with us. After almost a year of living under the same roof, I can affirm that she is an intelligent, thoughtful, and articulate woman. I have 2 more sentences.
Proceed.
She is an inspiration to anyone who has fought to survive childhood trauma. She is an exceptional mother who has created a home for her babies that is filled with love, honesty, and safety.
Thank you for being here. And once again, if any of you want to meet with the department,
We've been begging them for months to
I know,
meet.
but I'm just saying they are here and they did promise to me and the committee that they would meet. So I just want to let you know that they are here. I see them shaking their heads. So if you do want to meet with them,
We feel that it's necessary if they're going to have the table to tell us how much improvement they've been able to do. We want to shed light on what they haven't improved on.
and we want to hear. We
Yeah,
do. We
thank
do
you.
want to hear. So whoever wants to talk next, it's you have 5 minutes.
Mary Buck. In December of 2022, my 3-year-old little girl came back from an extended visit with her father, with her private area red and smelly. I wrongfully assumed this was due to her father not bathing her during her extended stay. So I reached out to her father and asked why she came back in this condition. He did not reply. Then in January 2023, after weekend visits with her father, she began using the bathroom on herself as well as pooping on the floor. Since being potty trained almost 1 year prior, she had never had any bathroom accidents. From there, my child's behavior only got increasingly worse. My 3-year-old began humping my children and I in bed, trying to make out with us all in bed, began to dig in her butthole and vagina, slap her vagina, and make statements.
Ma'am, I do have to, I hate to do this, but you've identified yourself, you've identified your child, and it's just from a legal standpoint, it's not the testimony that we can take here today. Now, if you want to meet with the department and talk to them about it, you've identified yourself, you've identified your child. It's created some exposure legally that I'm trying to protect you and your family and this integrity of this. So that testimony I can't accept. If it's concerning protocols, procedures, I can, but I can't accept that testimony. If you want to meet with the department, fine, but I can't accept this testimony, and I'm sorry.
Can you answer where we're supposed to turn when when all of this has fallen on the department's deaf ears? Can you point me in that direction? Because
We understand that they're here now, but for 9 months, they haven't
9
been, which
months.
is why these gruesome stories are being shared. It's actually why the stories even got to this point, because they knew about it in March and they were able to stop it. They did not, and they have not. So we just want to know if this is too much for the
Please
people
identify
here.
yourself.
Maggie Buck.
Maggie Buck.
If this is too much for the people to hear, Where do we go?
Well, in this case, we do have.
DCFS isn't listening.
We do have the legislative auditor, that they have a recourse there. We have the Inspector General's office, we have the Attorney General's
Reached out to the
office.
Inspector General's office. They told us that they are not in control of DCFS following their own policy, that they would only be there as far as them behaving criminally, but not in their policy.
We have the Attorney General's office too, that.
Also reached out to them who said the same thing.
No, there's no oversight for DCFS. So when children fall through the cracks, where do we go for help?
Well, tell us this without getting into details.
I have
of
a
family
testimony
member.
that does not get into
Okay, well,
detail.
tell us where it fell through the cracks on your end, but do not implicate a
For
person.
a person, okay.
Yes, please.
Let me just make sure. So I'm going to read their policy, and it's going to state things with their definitions.
See, that's appropriate.
Okay.
If you can tell us what policy has not been adhered to, what policy
Yes.
is not, that's the kind of testimony we can accept.
Okay, perfect. According to the Casey Foundation and their Kids Count data book, Louisiana is ranked 49th out of 50 states for the well-being of children. And after my personal dealings with our governing officials, as well as the Department of Children and Family Services, I am left wondering how any state could possibly rank worse than Louisiana. When starting the very difficult journey of protecting my 3-year-old niece from her sexual abusers, we naively thought that DCFS was an organization that would be a resource and an ally in the fight to keep my niece safe. However, after being ignored, lied to, and catching DCFS caseworkers conspiring against us, we soon realized that DCFS is not an ally for children at all. DCFS is not in the business of helping children. They are in the business of making money off of their abuse and trauma. Since March of 2023, DCFS...
Wait, again, I don't.
I'm getting to the policy
I need
right
the
now.
policy. I need the policy. You're giving me an editorial because I can find people that would say the opposite. Give me the policy and the violation of the policy.
Okay. In their attempts to cover up the many mishandlings of their caseworkers, DCFS has failed to follow the following policy.
Okay, that's good.
Validity standard. A credible child statement that is obtained in a forensically sound manner may be enough to determine an allegation of sexual abuse when a parent or caretaker, as specified in the definition of a caretaker, was the perpetrator. Am I allowed to say my niece or no?
No, don't say
Okay.
anybody, please.
This child has made statements of abuse in a forensic interview that is recorded. She has also made it to the counselor who is a mandated reporter and who has reported it on numerous occasions since March. That is against their validity standard. Sexual enticement. Non-touching sexual activity between a child and a parent caretaker. These intentional sexual activities could include some of the following: engagement in explicit activity in the victim's presence. The child has mentioned many times in detail sexual acts, not only in forensic interviews, but also to caseworkers and to her counselors, all of which has been reported to DCFS. She has also described in detail a lot of sexual acts to her family members, which has also been reported. Not only has DCFS failed to interview the majority of people who have put in these, who have reported this, but they have done nothing of it. Sexual manipulation or fondling, which is another standard of theirs.
Excuse me 1 second. Senator Luno?
Thank you, Mr. Chairman. Ma'am, let me explain to you what this committee does a little bit, maybe more, and we can get to what we can do to help in this. We can't adjudicate criminal charges. We can't.
We do not
we
want
can't-
that. We're not asking that.
I'm sorry?
We're not asking that.
That's
We're
what-
simply here asking DCFS to do their job, which is properly investigate.
All right, I understand you've said that over and over. Let me talk just a minute. I'm trying to help you to get to the point of
Okay.
what you want to do. We can't adjudicate criminal acts. We can't look at what is going on in specific cases. That's not what we do. That's what the department does. We are an oversight body that tries to help the department to improve on their policies and procedures. We're a policy-making body. That's what we do. If you tell us what we can do to help you with policy, that's something we can help you do. But coming here and talking about the specifics of a case is not proper in this setting. There are settings wherein you can do that. I'm sorry if these people weren't responsive to you that you've mentioned before, but those are the channels that you need to go through to try to take care of this. We can deal with overall policy and procedure of the department.
How are you able to deal with it if you will not hear the stories of how they're not following it?
When they're
Because
not
that's
following
the-
their own policy. So you help DCFS create their policy.
And
if
you help
okay,
ensure that
okay.
they follow it.
We can't all talk at the same time.
No, I know.
That's fine.
So my question
Okay, well,
is,
then
if
you need to be quiet and let somebody else talk while they're talking. Don't interrupt, please. I'm trying to make sure this all gets on the record. What I'm trying to tell you is that we can help you with policies. If you come in and you say, here's a policy in effect that they're not following, so we need to make sure they follow that policy. That's something we can deal with. If you say, here's a policy that's not a good policy or procedure, we need to change it to this policy or procedure, that's something we can deal with. We can help you with that. It does us no good to sit here and hear testimony about what your opinions are about what happened in a specific case. That's not what we do. That's not how we operate. We're the legislature. We're
So
not
can
the
we
people who-
testify to a specific
that's
policy that
what
they
I'm
didn't?
doing right now. I'm
No,
trying
ma'am,
to
you're
show
talking
you
about a
that.
specific case, and you keep referring to that specific case.
But it's how they didn't follow their policy in that case.
Then what the conversation should be is that they're not following policies, and that's a problem. It doesn't, it's, I'm trying to be very respectful
No,
because I know
I
this is
do, I
very difficult
understand.
for
I'm just
y'all.
not sure how we can present this information.
Do you want us to get a lot of
So what-
people together to say these are the
So
policies?
what you can
I don't
do-
understand.
I wanna
I
know
think we
how
have
we-
something for you. I think we have something
Okay.
for you. And not to cut you short, but Senator Boudreaux just went meet with the ombudsman, who's independent.
That's a
I think we
great
have.
idea.
I think we have a venue for you because what we're hearing right now is we very sympathetic. We see your passion. We're trying to find you because you asked the right question. Where do we go from here? So I think I'm going to turn over to Senator Boudreaux, and I think that your concerns can be addressed and heard in the right forum. Senator Boudreaux, it's all yours.
Thank you, Mr. Chairman. And ladies, I know one of the options were for you to meet with the agency today. That's not going to work, okay? I don't know if you all heard at the beginning of the meeting, the legislative auditor introduced Judge Ritchie, which is a brand-new position. That's exactly, you ask Ms. Buck, where do you go? And I ask her to step out, and she doesn't start until Monday. But these are some of the issues that the examples of the things that she would handle for the state of Louisiana. She is committed, although, as I said, she doesn't start work till Monday, that she would meet with you all. When things rise to the level where oversight committee, this goes above and beyond what we can do outside of policy, that was the purpose of creating this ombudsman position. She has committed to doing it. So I'm going to ask the chairman to discontinue any more testimony, and you all set up a time. And the way the process will work then is she will hear you out, and she will also, I think Secretary Rick said that when she came up, she will work with the agency. This cannot be confrontational any longer. We have to come to some resolve. That's the purpose of an ombudsman. So she is independent. She doesn't work for us, she works for the people of the state of Louisiana, just like the legislative auditor. And it's not a partisan thing, it's to solve problems. So I'm gonna, at this time, Mr. Chairman, move to discontinue any further public testimony on this specific case and ask you all to set up a time to meet with Judge Ritchie. She will then take over and let us know where things are. And in return, we will have another meeting, and then we'll go from there. But I just would ask that you all understand that and thank her for agreeing to do that at this point. Okay.
I tell you what, I know where you're coming from, and I guess I'll make this. If it's testimony that wants to be given and is specific about what this oversight hearing's mission is and its policies, its procedures, It's maybe staffing issues. It's maybe what's been adhered to. Of course, we'll take testimony.
No, yes, I was saying specifically on this issue that these three have started. So that's my motion was to accept what they have said, but not go any further. But if there's some others here for other issues, without a doubt, we're not cutting anybody off. This one, you ask, where do you go? Today, I'm asking you all to go on Monday and meet with Judge Ritchie, and we will be informed from that point where to from here.
I just have one question.
Sure.
When you're talking about, y'all are here to discuss like ideas of new policies and procedures and everything. I'm wondering if you guys could possibly consider giving the therapist and mental health care providers the weight, right? They sit with these patients that DCFS are involved in weekly. And so wouldn't it make sense, because you don't need a degree in psychology or anything to work for DCFS. And these caseworkers are going out into the field, seeing these children who are sexually abused, whatever, and doing their own case, their own work, their own assessment. The component that is missing is mental health. You're not going to walk up to a child and a child's going to say, oh, this and this happened to me. That's not always the case. The symptoms of sexual abuse are very broad and wide. And I think that it is a disservice to everybody not to say, you know what, this child is long-term counseling, however long, she's seen the same person for however long, let's add more weight, right? What the therapists are saying is going on.
And I think in the meeting that you'll have, and you will be the first of this legislation that's ever been created, and at the very beginning of the meeting, Mr. Wagerspack, who's with the legislative auditor, and I saw he gave you a card. This is really what this committee has had numerous debates, is for these issues you've brought out. And I want to thank Senator Boudreaux for reminding us, because this is brand new for us. I mean, this is brand new, and you will be the first recipients of this service, and you bring this out to the ombudsman, bring this out to the judge, tell her exactly what you said, because there's layers of complexity to this. We have the human service districts that offer mental health. There's the managed care organizations for Medicaid recipients that offer mental health. So there's layers and layers of complexity. Really, this needs to be more, from your vantage point, this needs to be more of a face-to-face working meeting of how do these solutions be resolved. And the ombudsman, which is independent, totally independent, they will take the appropriate action. And they work through the legislative auditor's office. So your question, really, from all our discussions and kind of doing a little crisis management just now, I think we've resolved where you will have a place of respect. You'll have a place of someone listening to you, and you'll have a judge with over 20 years of experience who understands the legal process. I think this takes a tough conversation and it brings it to the right venue. So in this aspect, from what Senator Boudreaux is saying, we would like to take any testimony concerning policy, concerning the work we've been doing. And what we've been doing is taking each department, their task, and looking at their timelines. We've been doing this all year long. So on that note, I'm going to turn it over to Senator Mizell from, I'm sorry, Senator Boudreaux, you still had the
Yeah. Just
apologize.
I just want you all to know, Mr. Wagerspack did it in the introduction. You asked a question about, we are so fortunate. Judge Ritchie, all of the things you just asked, she has worked in each one of those arenas. When you talk about the mental illness, when you talk about the abuse, not only as a judge, but on boards throughout her career. So I just want to assure you all that the question you ask is going to get answered. The person that's holding this position will have occupied so many different hats, and that factor, it will be weighed. So I just wanted to, I know today is Wednesday, and she's committed to Monday, but I want you to rest assured that you're not dealing with someone who just got a new job. She's been in this arena. We could not have found a more competent and qualified person. And it's the work of the Lord that today she was here and that you all will be assigned to her, and she's already accepted it. So I don't want to belabor it anymore, but I want you to leave knowing that you have someone who has knowledge and experience, and it's going to work with all of us. Thank
Okay.
you.
Thank you.
Thank you, Senator Boudreaux. Senator Mazzei.
Thank you, Mr. Chairman. With all due respect, I object to the idea that we're not going to let them say what they need to say because I've been in communication with them for how long? And could do nothing but hit a brick wall. Nothing but hit a brick wall. And it was incredibly frustrating for me. And I sit in this chair. So I can't even imagine when we're saying they're going to be able to go see Judge Ritchie, how many people don't have the avenue and don't know the avenue exists to get beyond. And Secretary Ricks, I fully appreciate your conversation. You've taken every call I've had about any situation. But we're at an impasse. We don't want to get into the dirty stuff. And this, I remember you saying the kids are not okay, like maybe 2 meetings back. The kids are not okay. And if we're not going to listen to the part, and I fully agree with the chairman, we can't get into names, we can't do any of that. But this, you are the three at the table telling this, but there are others out there who don't have the wherewithal and don't have the support system that you all have had for one another to do this. And if your story is not accurate, then that's still an alert. There is an alert going on in this child's life that is either one or the other. But it's our duty, if we're going to advocate for children, to do something about the situation. And this is, I believe, if it's a policy-driven thing, then we gotta, Lord have mercy, we gotta fix the policy. But when you talked about, what's your friend, Mary?
Yes, ma'am.
When you talk about the weight, if a professional is giving weight to a forensic interview of a child, and maybe we need to discuss this in policy, but something has gotten to be acknowledged when that child has multiple validations of a forensic interview. That's got to have, the weight added to it. So maybe that's something we need to look at legislatively. I don't know how we do that, but I get calls every week. I get emails every week. I don't know what to do. I mean, Secretary Ricks takes my calls and, I hang up.
Ours.
Well, she does mine, and I'm sorry for that. But it's got to be where it usually involves a frustrated person who's not being heard, who has a concern for a child, and I don't know what to do. And God bless Judge Ritchie, she's going to have a full plate stepping in, and I commit to being here. Is she camouflaged behind the post? I mean, we are here for you. We want to remedy the relationships and do something, but I don't believe we remedy that by saying you all can't talk anymore. I know how long you've waited to have someone listen to you. So anyway, thank you, Mr. Chairman. I'm done.
And Madam Pro Tem, I guess just to help everybody right now is, we're not a committee we can't try the facts. So you're making allegations, and we respect the allegations, but we're not the trier of facts. That's not what we do here. And I totally commend what everybody is saying. We think we found a solution for you to say the facts here, but for us to accept facts, we're not a court of law. And some of the allegations we just can't put into the record to protect everything. So I think in this case we can accept testimony that's policy driven, that's maybe a violation of policy, and we can talk to the department about it. You brought that up. That was a good part of the testimony. But to take your child's issue, which we understand, we can't do that. And I want you to know we respect everything you're doing here, and you've come here, but we're not a trier of facts of a court. And the allegations you've made, we can't either substantiate, and there's always different allegations out there. So that's why we set these parameters, not out of disrespect, but to protect everybody.
Thank you for that. Just to add to what Senator Mizell was saying insofar as the weight, she was echoing what I had said. I'm not only talking about the weight of an Audrey Hepburn one-time interview, I'm talking about a licensed therapist who sits with this child once a week, because that's the first avenue that the CAC sends you to. And Audrey Hepburn, if they can't get to the bottom of it, they say, put the child in counseling. Then the child sees this counselor for months at a time. And so where is the weight of the therapist's notes and the weight of their license insofar as mental health for children's trauma, these trauma specialists? Where is the weight in DCFS's policy? Because that would take the onus off of a caseworker from wherever you're hiring this person from, right? You're taking the weight off of these caseworkers, and they're working in tandem with a mental health professional, a trained specialist at that rate in mental health. And they're making these cases work. They're getting to the bottom of it because they're listening to the professional who sits with this child day in and day out. That's what I mean insofar as policy change and weight. Don't consider someone who sits with the child a single time. How long has this child been in therapy? How many disclosures? What does that path look like? And then add something in your policy to say, okay, if this child has been with this therapist, so much has gone on, this therapist is trained, what can you do to help DCFS not fail children? Because it is happening. That's what I'm saying.
That is perfect testimony. You hit it on the head. That's something we can put on our to-do list. Okay. That's something that's the kind of testimony we can accept.
Okay.
That was excellent.
Thank you.
Excellent.
I'm going to second that because, we constantly hear that there's not enough budget, that there aren't enough workers. Yet, children who go see these therapists, who see these doctors, why is the state and why is DCFS not using their free education, using their resources? We're the ones paying for the therapists. All they have to do is use their education, use their resource. If these DCFS workers are so overworked, why are they not reaching out to the professionals who do this day in and day out? Why are they not listening to them? Why does DCFS have the final say-so against doctors and therapists who do this all the time? If this system is so overworked and under budget, then use somebody else's education. Use something that your state didn't have to pay for, but that doctor's paying for. Use what we're paying for because we're paying for the visits. So it doesn't make sense for the caseworker to just totally throw out or not even put weight upon these therapists. It also doesn't make sense because they're the ones that suggest the therapists. And when the therapists make suggestions, it goes unheard. But even if you want to put money down on the table, because that's what makes the world go round, then save money and put it into the policy that DCFS and that therapist, if the child is seeing a private therapist, and if you can put however many parameters around it, this one therapist, two therapists, and the Audrey Hepburn Center. If it checks so many boxes, DCFS must be required to listen and put weight on that therapist. That will save y'all money. That will save DCFS and their overworked system time.
And that speaks to the validity, right? You can say, hey, this is a valid thing that's happening to this child. We're going to give validity to it. On to the next case.
Good. Listen, that's the type of testimony we're looking for. You hit it on the head. Both of you, you did a good job. We got there. It took us a little while to get there, but you gave us a good job. We take those notes, we put it in, and we work with the department on it. And thank you. We thank y'all all. Let's see. We do have some questions, Senator Luno. Let me get you on.
Thank you, Mr. Chairman. That's what we do. Let me tell you how that policy came about and what happens. And you guys don't know me, so let me tell you this. I've been a lawyer for 35 years. I used to work almost exclusively in the juvenile court system. I helped start CASA programs and all that. I've been a lawyer, free lawyer for a CASA program for 25 years. I understand this process. DCFS operates under the same laws that everybody else operates under. So generally, all of those same rules apply to them. In our court systems, in virtually every aspect of court, there is no one arbiter except for a judge or a jury. They decide, they make the final determination. Louisiana and every other state in this country and the United States does not let a single person involved in any sequence of events be the final arbiter. That's where the judge and the jury comes in your case, a judge, and they look at it and they use all of this information and they put it together and they make the best decision they can. Now, sometimes we don't agree with that decision, and quite frankly, sometimes the decision is wrong because we're all human and we err. But for the most part, those decisions are right, and they try to get things going back. I can't tell you it's a perfect system because it's not. But that's the reason we don't say we accept this person's decision on what is the best in the best interest of the child. That's why it's a melting of everything that goes around. And often the judges will take pieces and parts of what everybody suggests and do it. And sometimes we don't like that. But that's the policy behind it, and that's what we create. I don't know of any other policy that's better than that would work better, that would help us to get justice for these kids and to get them the help they need. And it is far from a perfect system. You know, I mean, I'm a big advocate for mental health. I do a lot of mental health legislation, probably because I need mental health help. But I'm a big believer in it. I wish we could get more money into that system to help children who have been in these situations, and we're going to continue to work with that. I'm going to continue to work with that. But that's the reason, and the reason I went through this long explanation for you so you can understand what that policy is. That's why we don't let one person, one therapist make the decision or one doctor make the decision. It has to be a joint effort. Everybody has to come together, and the judge makes the best decision they can make based on all of that. That's why CASA is a big part of it, because those folks are trained volunteers, but they come from various backgrounds and all that kind of stuff, but they're helpful. You know, they provide a piece of that puzzle.
So that's why I said there should be many check boxes. So right now, specifically in this case, everyone is on board but DCFS. And because DCFS refuses to get on board,
Tell me what you mean I'm not following what situation we're talking about.
So there are
DCFS's policy states how long until they need to find either a valid or invalid.
It's 30 days, and they've been investigating for 180. And I know you're breaking down how the court process goes, but I'm not talking about that. I'm talking about whether DCFS validates or not. And I said, not just for there to be one person. I said the counselor, the Audrey Hepburn Center, and right now we are dealing with a situation where the Audrey Hepburn Center, their counselor, and everyone who has their hand in this pot has said, where is the validation? And DCF is saying, we don't see it. So,
and sometimes that's what they believe. They
yeah.
truly do believe that. But the problem is this.
But they also are. No, you interrupted me. I wasn't done. But they're also. No, I was talking.
No, we've been very courteous. He's the senator. You listen to him. Hold on. Let me get you, Jay.
What I'm trying to tell you is that in this instance you're describing to me that's not a violation of policy. It's a difference of opinion. Now, whether or not they validate something or not within 30 days, that is the policy. That doesn't mean that it is ironclad, chipped in stone. It means that that's what you strive to do. In some instance, there's reasons why it takes longer or maybe shorter time to do it in. So there are various reasons. Policy is never ironclad and exactly the same. It's what you strive for, and some of them, hearing dates and things like that, of course, you can always do those. But some things come up where you cannot do it. You can't, there are various things that come about. So it's a difference of opinion about how that works. Go ahead, please go ahead.
Yeah. No. So in the policy that I was reading, I'm not talking about saying, okay, it's been 180 days, but their policy says 30. These are literally using their terms and definitions and saying, hey, this is the standard of finding a valid. And we have checked every single box. This child has reached out in so many ways, and they're saying, no matter what our policy says, no matter how we operate, we're not going to do it.
So that gets back to what Senator Boudreaux was telling you earlier. If you believe the policy's not being followed, you're not here to change the policy. You're saying they haven't followed their own policies and procedures. That's what you go to Judge Ritchie for. That's what her new job is designed to do, is to help people to get through that process when they otherwise don't have the resources to do it. And so we're hopeful that this is going to be a very good program. And it's going to be kind of overwhelming when it starts. I'll admit that. But we're hopeful that we're going to start seeing some good things come about that, and not only just resolve your issue or your issue or your issue, but other people who have similar issues to you. Because that way we have a pattern of what we're doing here, and we can follow that pattern.
Right. I do respect you being an attorney of 25 years, and I do respect all the work you've done. I really do. But we're standing on the outside. We have a different perspective, and there's no way that it can be just ignored by saying this is how it's done. There's no other way, because
It's not ignored, ma'am. That's what I'm trying to tell you.
they took the suggestions very well, I think. And suggesting that it should be reviewed by multiple people, that's all we're arguing. That's the policy. We would like for it to be reviewed by many people. And not just DCFS. DCFS shouldn't just have the final say-so.
Well,
And y'all, we have other people that want to testify. I think y'all have had a solution.
I just suggest that it sounds to me.
Wait. This thing's, why don't the three of y'all and the judge go outside? Y'all go outside and have a conversation, because this is where we need to, we have other people who want to testify, and this is what we're trying to say. Some of your issues are very specific.
I realize that we've been the problem children here today. I really do
You're
appreciate
not a
all
problem
of your time.
child.
No, this is what we're here for. This is what we ran for office for. We want to help you. We just realize your issues are unique, and you'll need to talk to the judge. Thank y'all.
Thank y'all.
Okay, point of order.
So I have a point of order, which I was hoping would kind of help clarify, at least give some kind of solace. I wanted to find out when our next meeting was scheduled, so that when we come back, hopefully we could have some of the issues that have been brought up addressed.
We will. I'm hoping y'all, if y'all okay with it, to give the department some chance, get some input from everybody, and have something towards November, December.
Okay.
And that would be kind of our conclusion of all the work we've been doing with the spreadsheets and the information here. But we'll poll y'all and see, because we'd like everybody here.
Okay.
So are y'all okay? I didn't even cut anybody short, but I do know we have some other people here that want to speak.